We know Medicare can be complicated. You likely have questions about what kind of coverage and plan is right for you. We know you want a Medicare plan that takes care of the whole you. A plan with the right benefits and coverage. A plan that best fits you and your health goals. We're here to answer your questions, and we'll make sure you understand everything you need to know to choose the best plan for you. We have affordable plans to help you keep costs low, with plan premiums as low as $0 a month and a limit on your out-of-pocket costs. Depending on the plan you choose, you could enjoy $0 preventive services like routine screenings, $0 PCP copay, $0 copay on over 100 prescription drugs, $0 lab services, and an over-the-counter benefit. Plus, help and support is here for you when you need it. We also have plans with essential benefits to help keep you at your best. Plans with dental, vision, and hearing coverage. All of this comes with the strong Aetna network of trusted local doctors, hospitals, and specialists. So you get the care you need and deserve. So when you have questions, we're here to help. At Aetna, we'll be right by your side. We'll help you find a plan that best fits your needs and give you the tools, guidance, and support you may need so we can make healthier happen together. Now let's talk about Medicare coverage options. Medicare is made up of 4 benefit parts: A, B, C, and D. Part B usually requires you to pay a premium, which can be deducted from your Social Security check. Parts A, C, and D may also require you to pay a premium. Parts A and B make up Original Medicare, which is provided by the government. Part A is your hospital care, which covers services like inpatient care, skilled nursing facility care, hospice care, and home health care. Part B is your medical care. It covers things like doctor visits, outpatient and home health care, and medical equipment. Part C plans are Medicare Advantage plans, which are run by private insurance companies like Aetna. These plans replace Original Medicare by providing both Part A and Part B benefits and more. Some Part C plans also include Part D coverage. We'll talk more about Medicare Advantage plans next. Part D plans offer prescription drug coverage, which can provide savings. You can get Part D on its own or by choosing a Medicare Advantage plan that includes Part D. Let's talk a bit more about Medicare Advantage. Medicare Advantage Part C plans are known as all-in-one healthcare coverage. They include Medicare Part A and Part B benefits, plus other useful coverage. These plans are administered by private Medicare-approved companies with government contracts, like Aetna, and often include added benefits like dental, vision and hearing care, and fitness memberships. Some Medicare Advantage plans, including many Aetna plans, even include Part D prescription drug coverage. With so many benefits, it's no wonder Medicare Advantage plans are becoming increasingly popular. To enroll in a Medicare Advantage plan, you simply need to be eligible for Original Medicare and apply during a qualifying enrollment period. We will cover enrollment periods a little later. But do note, if you have a Medicare Part B premium, you will still need to pay it with this type of plan. There are 3 kinds of Medicare Advantage plans Aetna may offer in your area. For each, you'll use doctors in that plan's network. A Preferred Provider Organization, or PPO plan, also lets you use doctors and hospitals out of the plan's network, but you might have a higher out-of-pocket cost. In most cases, you do not need a referral to see a specialist. If you choose a Health Maintenance Organization plan, or HMO, you might need a referral to see a specialist. With a Health Maintenance Organization with a Point-of-Service plan, or HMO-POS, you may go out of the network for certain services. For example, some plans allow out-of-network coverage for dental care. These plans often have a higher copay or coinsurance when getting out-of-network care. Going out-of-network may also require a referral from your primary care physician. Understanding all these different kinds of Medicare Advantage plans will help you choose the right one for your needs. Do you have both Medicare and Medicaid? If so, you could qualify for a Medicare Advantage plan known as a Dual Eligible Special Needs Plan, or a DSNP. A D-SNP is a Medicare Advantage plan created specifically for those who qualify for both Medicare and Medicaid. With a D-SNP, you could get added benefits that go beyond original Medicare. Talk with a representative to see if you qualify for an Aetna D-SNP and if plans are available in your area. Okay, let's get into prescription drug coverage or Medicare Part D. Knowing the 4 phases of prescription drug coverage will also be helpful to you. Phase 1 is the deductible stage. You'll be in this stage until you've reached your deductible. During this time, you'll pay the full discounted costs of formulary drugs. Phase 2 is the initial coverage stage. After you reach your deductible, you'll only pay a copay or coinsurance as part of the drug cost. Phase 3 is called the coverage gap or the donut hole. This phase happens after your yearly drug costs reach $5,030. During this time, you only pay a percentage of drug costs. Phase 4 is catastrophic coverage. Once you're out of the coverage gap, you only pay a small amount for covered drugs for the rest of the year. Now that we've covered the basics of prescription drug coverage, let me tell you about our pharmacy network. Aetna has over 65,000 in-network pharmacies. More than 23,500 offer preferred cost sharing. This means that getting your prescriptions filled is convenient and even more affordable. Finding a network pharmacy close by is easy. Just check our online network directory at aetnamedicare.com. You'll typically pay less when you get your drugs at one of our preferred pharmacies, some of which are listed here. Just find them in our online directory. And on the off chance that you aren't close to any of them, our network includes many local independent pharmacies too. The pharmacy networks may be different in our prescription drug plans. Check with a licensed Aetna agent for details. Formularies are lists of drugs covered by your Medicare plan. Before enrolling, it's a good idea to make sure your prescriptions are covered in the Aetna formulary. Keep in mind, these lists, pharmacies, and providers can change. So it's important that you check the formulary to verify your medicines and the group that they're in, their tier, before starting or refilling a prescription. You can view our formularies at aetnamedicare.com. It's important for you to have creditable prescription drug coverage. That means coverage that's as good as or better than what Medicare pays. In fact, it's required. The government may add a late enrollment penalty fee to your Part D premium if you don't have drug coverage. This may apply to you if you don't have creditable coverage when your initial enrollment period is over, or if there's a period of 63 days or more in a row when you don't have Part D or other creditable prescription drug coverage. As a reminder, if you have accrued this penalty and you switch plans to or from Aetna, the penalty will follow you to your new plan. You can avoid this penalty if you qualify to receive extra help. Extra Help is a Medicare program that helps pay some Medicare prescription drug costs, such as monthly plan premium, yearly deductible, coinsurance, copays, and coverage gap. Having limited income and resources shouldn't keep you from having drug coverage options. To see if you qualify for Extra Help, call 1-800-MEDICARE 24 hours a day, 7 days a week, or visit medicare.gov. Now that you understand Medicare, it's time to enroll. In most cases, you can enroll in a Medicare Advantage plan during specific times of the year only. The main enrollment time is the annual enrollment period. This is when anyone eligible for Medicare can enroll in or disenroll from a Medicare plan. If you are enrolled in other plans, you should talk to your plan or benefits administrator before enrolling in a new Medicare Advantage plan. In some cases, joining a Medicare Advantage plan might cause you to lose your other coverage. The annual enrollment period runs from October 15th to December 7th each year. Coverage then begins January 1st of the following year. The initial enrollment period is the 7-month period that begins 3 months before you turn 65. It also includes the month you turn 65 and ends 3 months after the month you turn 65. However, this timing could be different if your birthday is on the 1st of the month, Please visit Medicare.gov for more details. If you want more information about Medicare and your options, you can download an enrollment kit. Inside this kit, you should find a What to Know section that explains all you need to know before choosing your plan, a Medicare Basics section that explains the Medicare essentials you should know, a Summary of Benefits section that provides a summary of your benefits and a general understanding of your coverage and responsibilities. For details, refer to the plan's Evidence of Coverage document, a Medicare Star Ratings section to learn about Medicare Star Ratings. We'll cover more about this on the next slide. Finally, a How to Enroll section to help you get started with joining a plan. Medicare Star Ratings let you know about a plan's quality. Each year, the Center for Medicare and Medicaid Services, or CMS, rates the quality of all health and prescription drug plans based on a scale of 1 to 5 stars. 5 stars is the highest quality. They use information from member satisfaction surveys, health plans, and healthcare providers to give overall performance star ratings to plans. CMS Star Ratings can help you compare plans based on quality and performance. You can find Aetna plan star ratings in your area by visiting our site online. Once you enroll in an Aetna plan, you'll receive your member ID card in the mail. It has the basic information you and your providers need, like your member ID number and important phone numbers. These include our customer support numbers and 24-hour nurse line, so you can get answers to your health and benefit questions anytime you need them. Your card also includes a QR code that you can scan with your phone to reach specific plan information and to access your documents. We appreciate you taking the time to learn more. Getting the right benefits is so important, and we want to make it as easy as possible for you to find the best plan for your needs. Let's answer your questions and talk about your available options now. We can even help you sign up for coverage.